Hey everybody, we are live. Welcome to Real Talk with Matt Sova. I'm here with Brad Bengtson and Dr. David Alfonso here at the Bengtson Center. What's up, you guys?
Welcome.
Thanks for having me.
Yeah,
Well, actually, here, cheers. We have to do
cheers.
cheers first.
Absolutely.
We've got Ken over at Bowdie's here in East Grand Rapids made us these fantastic Manhattans.
They are fantastic.
They're very good. They're very strong, but they're very good. That's
Love
not a bad
Bowdie's.
thing.
Yeah.
It's my fave.
Look, I think it's the best steak in town, no
Yes.
joke.
Oh, absolutely.
So we're all out of quarantine. We've survived. We're trying to get back into the real life, get back into business, get back into the swing of things. How are you guys feeling? How'd you do?
Really well. I mean, I thought we navigated COVID as best as we could.
Yeah.
It was a big change with all the screening and cleaning and all the stuff. It kind of limited our flow through the office. Surgery-wise, I don't know if it's just all the pent-up demand and people traveling less, having more, financial ability, but we're just like absolutely booked out for months.
That's so good. I think people are just ready to get back to normal and, I don't know, have their daily lives and see people and go do things and have events and actually put some clothes on, get dressed and have some fun.
Definitely, yeah. I think we also noticed a lot of people working from home, a good recovery time. You could work from home within a day or two after most of our surgeries versus spending a week or 10 days out of the office.
That makes a big
So that
difference.
working at home was kind of a silver lining in this whole kind of craziness for cosmetic surgery in regards to recovery.
Well, shoot, I guess I should have got something while we were like,
Yeah,
I was sitting at home, that would have been great. No one would have known.
No.
So I was going to ask you, how has COVID changed the styling, aspects? I feel like I've been in scrubs for a year, and just now we're getting ready to go out to dinners and events, and we have our big fall event coming up. We're super excited about.
Oh, that's right. That's the
October 13th.
Okay.
Yeah.
What is that called again? I forget.
All the glows.
All the glows. Yeah, that's a great event. That'll be fun to be able to be able to do that again here.
We'll definitely be here for that.
Well, I hope so. I always like being here.
Yeah.
It has changed. I definitely think people are ready to kind of put themselves back together, but in a weird way. And this is just me personally saying this. I feel like sometimes you get ready and you still kind of want to put on that comfy shirt or maybe those elastic waistband pants or something. You know what I mean? Even though you want to look nicer and you want to look better, but I think people are slowly trying to adapt. And I know for myself, I've definitely gotten a little bit more relaxed, and I think some of that's going to start rolling over, into business. I think if especially with guys. I think, wearing a sport coat or a suit it's going to happen again.
Yeah.
But I definitely think there's going to be a little bit more of a relaxed approach to it. Jackets that, are made out of a knit or, with a softer shoulder, almost like a cardigan. I know for myself, I picked up a couple jackets that were like that. They're comfortable and they make a pair of t-shirt and jeans look, a little bit more
Dressed
elevated.
up a little.
Yeah. But
I did wear a tie 2 weeks ago. It's the first time in about 17 months.
Yeah.
How'd
My
that
niece
feel?
got married in Ohio, so I wore a tie. It felt good and not good. I mean, it's good to wear it, but I still feel like, especially in our practice, patients really kind of like the sort of comfortable feel of informality. We're really professional as providers and as people, but I think sometimes when you overdo it in the office setting from a dress perspective, it can be intimidating or stuffy, and we're just not like that. So.
I guess that actually is good for me. It's a good question. I think do you guys want to start getting dressed back up again? Do you want to put on a suit every day? I mean, is that something that you guys want to do?
Not me. I almost didn't recognize.
You know what I mean?
Yeah, I almost didn't recognize.
That's the reality right there. That's real talk.
A suit, not really, but pants, yeah. It feels good to wear a real shirt to office, but we were wearing scrubs, as Brad mentioned, for a long time just because of trying to make the environment as clean and not bring clothes in and out of the house and things like that. So.
Gotcha.
Yeah, sport coats and button-down shirts, good for me.
So I have to ask you, do either one of you guys have a little Hawaiian or a floral print shirt in your closet for summer? Because that's actually one thing that you probably should have.
Yeah.
Because those camp shirts are really they're huge again. You got young people wearing them to old people. So I mean, it's it was all the rage.
Yeah. I got a couple, but I'm tending to find myself liking a little bit more monotone colors.
Mhm.
Like, you know, I have like a black and a blue, you know, like Hawaiian, you know, fit in floral print. But
Yeah.
it's not like the multicolored things
Right.
that used to be, you know, out and about.
Well, you know what's funny over the years, I think helping you, Brad, you know, I always wanted to kind of work with your personal style. I think, you know, and that's always been a big thing for me with my clients, like not, you know, let's say, you know, zebra print shirts are in style, you know, like you may not be the zebra print wearer. Some of you out there are, and if you are, I will put you in one.
Yeah.
However, it's one of those things where you kind of want to take the trends like of the, you know, the season and stuff like that, and maybe like, you know, cherry pick some of those items to kind of like put into somebody's wardrobe. But I think it's a really important thing when, you know, styling with people and really getting a sense of your personal style, that you're like kind of honing in like what you like and what wears well on you versus the clothes wearing you.
Yeah.
You know what I mean?
Mm-hmm.
Yeah.
I think that's a
absolutely.
big thing. I see a lot of people that, you know, they'll throw on some of those trendy things and it's
Yeah.
like,
Yeah, I feel, you know, what I really like about working with you is that you're almost like an interior designer, but you're not like pushing new fashion trends or something. You kind of get to know the individual people and kind of what they like, and then maybe kind of pull them out a little bit and kind of work with them, and you know, trying to, you know, get them a little bit more fashion focused and stuff, but not really pushy or anything like that.
Thanks.
So
I
it's
think
good.
I think that's how you make a really good. That's how you get a good relationship. I think that's how, once you get to know who you're helping, I think that makes a big difference.
Mm-hmm.
You know, even like pushing like some of these sneakers, like this summer. Even for me today, I have on these like really cool little Cucinelli sneakers, but like, you know, sneakers with dress pants nowadays, like really nice and clean. There's brands out there like Common Project that, you know, younger guys can wear to our age. I don't know how old you are. I know how old I'm gonna be, and I'm a little freaked out. But you can still wear it. You can still dress it up, which is really nice. You can totally throw it on a pair of shorts, you know, and stuff like that. And it's really clean. That was one of the big trends that I really liked a lot, because then you got comfortable footwear, especially in the workplace.
Yeah, that's huge for us on our feet a lot, both, you know, either in the operating room, but especially when we're seeing patients, it's kind of bouncing from room to room to room. So you kind of want to mold, you know, mix the fashion, but also function for us.
Totally.
I mean, that's really important too, because you can't be uncomfortable, you know, look good for 15 minutes kind of thing, because we're working, you know, from morning to evening and afternoon. So
that makes a big
it's got to work.
difference.
Yeah.
It's got to be comfortable.
You totally have to be comfortable, and I think that's where that whole thing of like kind of like taking comfort into the workplace again. It's funny because when I was like checking things out, there's brands like Champion and Nike and New Balance that kind of have like that everybody approachable sort of, you know, sportswear line. But then you have brands like Todd Snyder, who kind of takes some of these like sporty vibes and actually kind of turns them into like everyday sort of like workwear. So you can have like some comfort. So you're not like wearing sweatpants, but you've got a pant that has like great 360 stretch, a nice like, you know, stretchy shirt that's comfy and movable, you know, so you're not like stuck. I remember for a while like raw denim was a big thing, and those were like the stiffest jeans I think I ever wore. They were so uncomfortable.
Right.
Like now I don't want to have a pair of jeans without stretch. Like no joke.
Yeah.
That's definitely true. Yeah, I feel like I'm doing some things right. I came home and my 17-year-old had my shoes on.
Oh.
You know, so I'm like, what? Wait, what? I mean, you know, didn't ask or anything.
That's good, Brad.
That's a good sign.
It's good, yeah, you know, kind of white bottom shoes.
So you've got good style.
Yeah, it's good.
You know, you got
Made me feel
professional,
good.
throw on a tie. You
Yeah,
know?
exactly.
You look young.
Yeah.
I don't know if you noticed, but have you seen some of these 50s trends that are happening? There's these polos that have stripes that are like, you know, really cool, like, you know, thinner knitwear for summer.
I haven't seen
Have you ever seen any of that?
We rely on you to tell us.
Well, don't laugh. I mean, it's kind of fun. So I think that's what's interesting about like what's going on right now in like the industry is that it's almost a free for all. There's so many things that you can do. There's so many trends that you can kind of follow, or you know, whatever is comfortable for you. I know for myself, I have a tendency to wear like t-shirts and blue jeans. I should probably like amp it up a little bit more. But I'll tell you what, those little polos, they're stylish, they're easy, and they're a great fit. Especially if you're trying to like, you know, show off those guns. Sun's out, guns out. I've been trying to work out a little bit. I've been going to Forever Young Studios, this kettlebell class, which is kind of kicking my butt, but hopefully it's getting me back into shape.
Yeah.
But, you know, it's kind of fun.
That's great. Yeah.
So have you guys been having any issues with your skin over the quarantine? Did you come out with like any rotten pimples, bad wrinkles, stuff like that?
Yeah, it's funny you say that. There definitely is like this mask face going on. So we're seeing a lot more acne breakouts and a lot more just oily kind of collections. And I think people are just a little bit more lax taking care of their skin. It's, you know, I always say that it's the biggest organ of our body, but it's probably the most neglected as far as like skincare and sunblock and, you know, all those things. So definitely we've seen a lot more, but we've also seen a lot more focus on the eyes and forehead. So like Botox and everything has really exploded because, you know, particularly with mask and with all the Zoom, you know, Zoom calls and all that stuff, you know, there's been this big focus on the face and angling of the face and chin to, you know, kind of hide the neck and stuff like that. So, have you found that?
Yeah, I think so. I mean, the maskne, you know, you hear that term, and I do think there's definitely something to it because there's so much variety in skin in terms of sensitivity and oil content, and you know, people respond differently to masks. And I think we definitely saw a lot of that in terms of skin irritation. This time of year, it's really kind of talking about sunscreen. I mean, that's really the big factor because of the potential issues of health ramifications for skin cancer down the road. And we obviously, aside from the cancer, it just accelerates the aging process, right? So we want to tell our patients, if you invest in a surgery or a non-surgical procedure that has some downtime with it and, you know, costs some money, you really want to protect that investment. It's just kind of like anything you acquire that is, you want to kind of improve and value over time. And if you do one of these procedures and just go bake in the sun on a boat, you know, every weekend in Michigan without really making efforts to protect your skin, you know, aside from the skin cancer thing, but even less seriously from an aging perspective, it's gonna kind of put the foot back on the gas for aging. So that's really key. And I think guys especially, you know, need a little bit of reminders, and their wives tend to remind them, but we're really bad. If you're on the golf course, I used to never put sunscreen. I would just go golf and put
I'm the same way. I love being outside. I love having a little bit of a crispy tan, you know, especially in the summer, because we're in Michigan, you get 3 months, so you end up like cooking yourself, which is actually probably worse, because you're like, you know, limited exposure for so long, and all of a sudden, like, you just like throw yourself outside. So I'm definitely guilty of it.
I think one of the big benefits of some of the new skincare products, both Dave and I, we were talking about this before, we use SkinMedica TNS. And so the great thing about a lot of these new skincare products, and they have some great new, like Skin Better has a great roll-on sunblock and stuff like that we use, but a lot of these products will combine like 8 things. I mean, it's hard to get a guy to actually wash his face, and then it's really hard to get him to apply multiple, you know, product layers on. So the great thing about a product like TNS, it actually has like growth factors and all these different antioxidants and retinols and everything. It just kind of all in one thing. So just squirt, rub it on, you know, morning and night, and you're good. So it's really been simplified a lot, and I think
that's awesome. And I think that I'm not gonna lie, I kind of wish that more products would actually be, you know, kind of a one-stop shop, if you ask me. I mean, I definitely have a skin regimen, and luckily, it's funny when we were talking about this, about doing this talk about skincare with like the Zeo products. And I'm happy to talk about it because I use the products and I like them, and they work for me, which is great. But I have like, you know, I have my regimen, I have my cleanser, then I use like these, you know, great little pads from Zeo, the renewal pads, then I put a vitamin C on, then a lotion, then an eye. You know, so there is some steps.
Got it all going on.
I try, but I'm also, the funny thing is I get greasy too. But then that also goes to like being out in the sun. So then trying to like make up for the fact that I've been like cooking myself outside, you know, to try to like make my skin look better, you know, because that's what everybody sees first, you know, is your face and, you know, what you're wearing. So, I mean, it makes a big difference. And Botox too. That was a big thing for me, you know, continuing to do Botox, I think, for the past, with you guys, for maybe like 8-10 years ago. It's so crazy.
You're prima donna in Botox, right?
Well, you know, it's helped. You know, I'll be 45. I definitely feel that I think I look my age, but I don't think I could look older.
I think the key thing just on that is that I always tell patients that if you have Botox or filler, it should not be visible or palpable.
Yeah.
And so if you have like the peak brows or you have palpability of the filler, it doesn't have to be that way. So it should look very natural and be a benefit, right, versus a negative. So
It's funny you say that, because I feel like you've said that for so many years, and I think that's one of your almost like your mottos. I think that's one of the great things about you guys, is that you don't make people look like they've had too much.
right. It's all
Because that can happen really quickly.
Oh, yeah.
Especially in the male population, we've seen a lot more than over the years. Each year kind of ticks up a little bit the percentage of skin care patients, who are injectable patients who are male. And I think there's a much more socially acceptable there's less of a stigma. Guys want to look good too. They're not going to go and do all the things that tend to be done by a lot of the female patients. But, in terms of bang for your buck, Botox, TNS serum, those are the things that are going to last a long time, in terms of the benefit that you achieve with that. And I think males have become way more open to getting a little bit of Botox just to soften things.
Totally.
And the hard part is, I think that we've done a good job of educating and trying to promote that, but people feel like you're going to look like an overdone, Hollywood disaster when you're not. You're going to look just like you.
Yeah.
You're not going to look crazy. You're just going to look softer, just a little more refreshed. And that's why Botox, I think, has just been huge, taking off with men. Year after year, we see more males who come in for that, and fillers and that. So it's been really cool to see that the males population is really open to that and kind of accepting it. And I think a lot of them are pushed by their significant others, or spouses, or girlfriends, or whoever.
Totally.
Boyfriends are just like, you should try this, and it's a subtle way of sort of nudging them to do something.
I agree. Even getting a facial, I love hydrofacials. Those are fantastic for me. You get a great exfoliation, amazing serums, pumped into your skin. And even to take it just a bit further, just guys, go and get a manicure and get a pedicure. It's okay. You're gonna put sandals on. You're gonna have cruddy feet from winter. Just go get a pedicure. It's no big deal.
Yeah.
It makes a huge difference. It's just to me, I almost look at that as just general maintenance.
Yeah.
It's nothing wackadoo.
Yeah.
Guys are kind of resistant to that.
They are, and I
bit.
don't know why.
Yeah.
I don't know why. But
it reminds me of this really brief story, but it's kind of funny. I was at a plastic surgery meeting once, and there was a plastic surgeon from France.
Yeah.
And it was in the United States, but he was talking to all the male American plastic surgeons. He's like, it's okay to drink white wine. It doesn't make you a woman.
Right?
It doesn't make you feminine, because they appreciate the difference of varieties of red wine. But he goes, in the United States, there's this stigma where women drink white wine and men drink red wine.
Absolutely.
And if you cross over, you're like, oh, what's is
I know,
that
it's
weird?
Stupid. Hey, I will drink rosé all day. Give me bubbles, rosé. I'll drink white wine. I'll drink red wine. I might drink, everything kind of wine. There's no stopping me on that.
Well, one of the big benefits of COVID is we had a little bit of a downtick in people coming in. So, we have 6 estheticians and 6 or 7 aesthetic expert injectors that are always full. I mean, especially now, if a day opens up, it's filled in 15 minutes.
Holy cow.
It's just so busy, and people are booked so far out. But the nice thing about it is, when it was quieter, I mean, I was down getting hydrofacials and cool
that's kind of
sculpting
nice.
and all these other things.
Pampering.
That, I haven't really had the opportunity to take advantage of as much because they're just so busy. So.
So what did you think of cool sculpting? What did you think of getting those facials?
Yeah,
were you why didn't I do this before? Or, do you think you'll continue to do it when you have time?
Yeah, I've always taken advantage of all the stuff that we do, particularly all the non-surgicals and stuff. I get Ulthera about every 3 years. I'm set up to get Profound, this new skin tightening system.
Okay.
It's kind of like microneedling with heat.
Okay.
And so it gets a resurfacing, but also a skin tightening aspect of it.
Oh, cool.
So, and I'm just trying to push the pathway down. So before I need the surgical procedure and stuff. So.
Well, I think that actually leads us to our next subject, because the 3 Musketeers here, we've all had NeoGraft.
Yeah.
So all of our hair has been basically moved from the back of our heads to the front of our heads and the top of our heads. And I was lucky enough to come in right when you guys had gotten all the technology in to have this procedure. And you know, I'm pretty ecstatic about my outcome. I had a major, you know, difference in my hairline, and I mean, like, now the comparison is completely different.
Yeah.
I love it.
Yeah. It's awesome. You got a great result.
Thanks.
Yeah.
Thanks.
So
thanks to you guys. I mean, come on.
It's great. We're actually redoing our website. We just launched our main website again, but we're developing a hair restoration website, like a microsite.
Oh, sweet.
So hair really is more than just surgery. We offer all these different things. There's like Keravive, which is like a hydrofacial for your scalp.
Okay.
There's light therapy, topicals, vitamins, you know, all these different things that
Plus, you
kind
guys
of go
have
along.
shampoo and conditioner
Yeah,
as well, right?
That's right. But really at the base of it is NeoGraft. And early on, you know, we were looking at different hair transplant techniques.
Yeah.
But usually involved a pretty significant surgery with strips and a little bit of a visible scar in the back. And when NeoGraft came out, it basically just transfers individual fine little follicles of hair that has either 1, 2, or 3 hairs in it. And both the donor site is invisible. We just take about 18% of the hairs randomly from the back and just transplant it in. So I had marked thinning, like all the way in the front, all the way back to my crown. And about 2 years ago, I had about 3,200 grafts put in. We have an amazing team that comes in who has about 20 years of experience, and it's just simply the best.
The technology is incredible. The fact that you don't have any scarring. I wear, you know, I grew my hair out during quarantine. I decided to cut it all off. So Sarah Brindle Blonde finally like cut everything, and so now I've got this nice, like, you know, tight fade, and there's no scarring.
Yeah.
You know, like the traditional, you know, hair transplant, you'd have that big scar on the back. I mean, it just looks so archaic now.
It does, and you hear a lot about plastic surgeons sometimes use this term scarless when there really is a scar, it's just hidden somewhere.
Yeah.
You know, but NeoGraft is truly scarless procedure because it's really no incisions at all. You're not really cutting with a scalpel. It's literally just harvesting the little hair grafts and then, you know, transplanting them into the front. So it really is amazing. The downtime is definitely way less than it used to be when they did more traditional techniques. And I think a lot of males, when I've talked to, just the fact they're interested in it because of not having that big scar from ear to ear in the back. And that for a lot of guys, even though they were really desperate to have improvement in their hairline, that was like, you know, that was a hard no. There was just no way they were going to deal with that.
I feel like if I would have, like, if that was the procedure that you guys had here, that you offered here, I probably wouldn't do it. Because I wouldn't want to have that. I mean, not to be too vain, but it's just, you know, I'd rather just, like, buzz my hair down and just kind of, you know, let nature take its course.
And there are very, very few procedures that really provide a permanent outcome. And when you transfer the hair from the back of the head, you have this donor dominance, and basically there's probably about a 96-97% survival rate of the grafts. We look at each of the individual grafts underneath the microscope before we, you know, transplant them in, and it's just an incredible procedure.
It is, and I'm stoked that I had it, and I love my results. And Dave, like, yours looks fantastic too.
Yeah, I mean, I'm really glad. I tell when I talk to our you know, patients, not just males too. Males can do it. But when I talk to either a male or female patients who come in to talk with me a little bit about it, I give them. I'm totally open with it. There's no reason not to be. And I talk to them. I mean, I had mine on a Friday, and you know, it's a little bit advantageous because I work in an office and I go to the OR and I operate. But I told them I had mine on a Friday. I was back Monday morning operating. I had a cap on. You couldn't see my head. I mean, you feel great. It's just you know, there's a little bit of downtime with how your head looks, but it goes by very quickly.
Itchy.
Yeah. It was itchy. It got itchy.
Yeah.
But, you know, it's funny. I mean, I look at, like, the whole, like, you know, from start to, like, finish. You know, it was a blip on the radar. But I'll tell you what, like, that first time that I could actually, like, scrub my head.
Yeah.
I don't know about you guys. Dude, it was the best shampoo I think I've ever had in my life. It was so good. I felt amazing.
It's true.
Yeah, it's a great procedure, and I think that, you know, the technology has really made it much more accessible to a lot of people who would not have considered it. And as I mentioned before, it's not just for male pattern baldness. A lot of women have hair loss in patchy areas, you know, on the temporal area here, or in the top or the crown of the scalp. And so we have a decent number of female patients who have undergone NeoGraft and done
So
really
cool.
well. Yeah, they're a little bit almost at an advantage because when they take the hairs from the back, usually they leave hairs up front so they can almost cover it almost like a curtain.
Oh wow,
Yeah.
that's kind of nice.
Yeah, exactly. So, but it's been a great addition to the practice. There's no question. It's kind of growing year over year.
Yeah.
That's pretty sweet.
Yeah.
Well, it's nice to be able to have that right here in Grand Rapids.
Mm-hmm.
It's awesome.
Well, giddy up, you guys. This was awesome. I'm so glad you had a chance to, sit down, kind of, hang out,
Shoot the
chit chat.
breeze,
I wasn't going to say
Awesome.
something else, but I was trying to keep it a little cleaner.
Yes.
And, but yeah, hopefully we can do this again.
Yeah,
and
great.
to everybody out there, I've got some information. So, everybody, if you guys post your story on Instagram sipping your favorite cocktail or mocktail, just make sure you tag the Bengtson Center to be entered in the Sova Social Hour giveaway. And what are those prizes, you're wondering? 2 lucky winners are going to receive the ZO Daily Skincare Program, which consists of a cleanser, a skin polish, which is incredible, the renewal pads that I actually use, I love, and the Power Defense, that's like a value of $200 almost. Or to our friends from Bowdie's, you can get a Naughty Tomahawk for 2, and a Skin Better Men's Solo Hydrant Defense Serum, which is what Dr. Brad was talking about. It's like that one and done serum, and that values for like $160. So remember to do your post your story on Instagram, and then the Bengtson Center, Bowdie's Chop House, and me, Matt Sova. That is a wrap, you guys. That is real talk. Hopefully, we'll see you guys next time.
All right.
Thank
Thanks,
you.
guys.
buddy.
Cheers.
Great.
Cheers.